started using the Macy Catheter in 2014, and one of the reasons was we couldn't seem to get patients comfortable with IV therapy, and we found that giving them medications rectally was easier and more effective, and unfortunately families were resistant. So when the Macy Catheter came along, our nurses were able to insert it, teach the families how to insert the medications. The families were very comfortable with that process, and we found it to be much more effective and actually more cost effective than doing IV therapy or IV pain medications. Honestly, it's easy to, the clinicians at first look at, especially if they come from an ICU or ED background, they look at us like, really? You do what? And so we use the YouTube videos that are available, plus we use the literature and the Hospi website information, and then our nurses just tell the stories of helping patients, and especially, those 3 a.m. wake-up calls, that, getting other medications is going to be problematic. So we have used the Macy in those situations, and usually after one of the new nurses uses it one time, they're sold. They realize that it really helps their patients and their families be much more comfortable. Don't be afraid, don't be resistant to it. Again, it's just really, we feel, helped get our patients more comfortable at the end of life. And because of that, I think it's a tool. It's just another tool that we use. So typically our nurses say, we can continue to manage your loved one's pain or other symptoms with the same medications, and we just administer them rectally. And we have a catheter that we can use, and we place the catheter, and then it's just a tube, and you just attach the syringe with the medication in it and push it through that tube. And then they're just like, oh yeah, I can do that, let's try that. So, and especially if it's they're suffering or their symptoms aren't really managed, and they know that they didn't want to go back to the emergency room or the hospital, then they're kind of open to whatever. So it's just another, like I said, just another tool in our toolbox that we offer, and most families are very, very open to that.